Well, thank you. I am so glad to be with you in this great conference. My topic today about retinitis pigmentosa, one of the most common causes of blindness all over the world. Retinitis pigmentosa is an inherited degenerative eye disease that causes severe visual impairment and often blindness. A form of retinal dystrophy, retinitis pigmentosa, is caused by abnormalities of photoreceptors, rods which are responsible for peripheral vision, cones which are responsible for central vision and color vision and acuity of vision, and subsequently the retinal pigment epithelium of the retina, leading to progressive sight loss. Affected individuals may have a defective light to dark adaptation or dark light adaptation, nyctalopia, as a result of degeneration of peripheral visual field. Sometimes central vision is lost first in retinitis pigmentosa inverse. This picture shows fundus picture of patients with peripheral retinal degeneration, bony spicules, and we can notice that attenuated blood vessels and optic atrophy. As we know, retina contains 10 layers, photoreceptors one of these layers, and now we can see loss of photoreceptor and subsequently retinal pigment epithelium. As we know, mesenchymal stem cells are progenitor of all connective tissue. A number of studies have shown that bone marrow-derived mesenchymal stem cell can differentiate into cell-expressing photoreceptor proteins, while induced pluripotent stem cells are embryonic stem cell-like pluripotent cells capable of differentiating into most, if not all, body cells. We got mesenchymal stem cells from bone marrow, while iPSCs from peripheral blood by chemical non-viral method, 200,000 per 0.0 milliliter of both. We aim in this clinical trial to know the safety of and efficacy of IPS in patients with classic retinitis pigmentosa and compare it with mesenchymal stem cell, vitrectomy versus intravitreal injection. We got approval from Bioethical Committee in the Faculty of Medicine, Al-Azhar University, Cairo, Egypt. Our patient inclusion criteria starts from diagnosis of retinitis pigmentosa, willing to participate and able to come for follow-up, stable clinical course of over 6 months, as we know it's progressive disease, best corrected visual acuity less than or equal 3/60, media clarity, pupillary dilatation, patient cooperation sufficient for adequate fundus photography, and last, informed consent. While exclusion criteria optic disc disease like glaucoma or optic atrophy from other causes, diabetic retinopathy, bleeding disorders, macular edema, non-cooperative patient not willing to consent. Preoperative evaluation, detailed history of present and past illness, best corrected visual acuity, electrophysiological tests include ARG and VEP, visual field, intraocular pressure, optic coherence tomography, fundus photography, and fundus fluorescein angiography. We divide patient in 2 groups. Group A injected with mesenchymal stem cells by 2 methods, intravitreal and post-vitrectomy, while the group B injected by IBS at the same methods. In this slide, we can see in this video I think this we can see in this video complete sterilization, patient under topical anesthesia, injection of stem cell 3.5 milliliter from the limbus, this 0.1 milliliter of stem cells, fixation of the globe, 3.5 millimeter from the limbus, injection, then paracentesis to ensure there is no increase in intraocular pressure after operation. Okay. We can take the next video. The next video. This. Yeah, there is no. I press escape. Okay. Nothing. Video of vitrectomy injection after complete vitrectomy by the same amount. Follow up for 1 year as the following: visual acuity, intraocular pressure, visual field, electrophysiological test, OCT, and fluorescein angiography. Result: Group A, improvement in visual field and visual acuity, while there is no significant improvement in electrophysiological tests. In Group B, there is also increase in visual acuity, visual field, and also electrophysiological tests. In this slide, we can see the change in the visual field before and after. We can notice the yellow area, which is the most sensitive part of the retinal patient retina, sorry, and this, the green one, less sensitive. This other slide of the other patient, increase. In the retinal sensitivity and also visual field. Multifocal ERG, we can note the difference, and this. Fluorescein angiography of many patients included in our study, while this patient is not included because there is a macular lesion. Also OCT of include patients. This patient is not included because there is macular lesion. Side effects: IOP increased in the first 2 weeks after injection, controlled by beta blocker drops, eye drops twice daily. Reaction in 1 case in Group A, mesenchymal stem cell. Blurring of vision in the first month postoperative in all intraocular injection. Conclusion of our preliminary results: intravitreal injection of stem cells seems to be beneficial in case of retinitis pigmentosa with visual acuity more than 1/60. Vitrectomy enhances the effect of stem cell therapy in case of retinitis pigmentosa. Induced pluripotent stem cell is better than mesenchymal after 1 year of follow-up. Acknowledgement for my team, especially for Dr. Fauzi, the biologist, head of the biologist. Thank you.
Hi, I'm Nadia Jahrudi from University of Alberta. I enjoyed your presentation. I was wondering if you know what happens to these IPS. Do they differentiate? Do they incorporate? What is the fate of them after injection?
What is the fate of them after injection? So, in our disease, retinitis pigmentosa, we aim about photoreceptors. Our primary cell loss is photoreceptor. So increased in the visual field in patient with classic retinitis pigmentosa, we have defect in photoreceptors only. So we didn't take any patient with macular lesion, which have photoreceptor and retinal pigment epithelium, you know.
No, I was just wondering if you know the IPSs, do they differentiate into the retinal cells? Do they just stay as IPSs and through production of growth factor or other means they help the repair of the photoreceptors, or do they actually differentiate and form photoreceptors?
Yeah, of course.
They do.
Differentiate.
Has any animal model available for those disease?
For
animal model available.
Motor?
Animal. Is there animal model available for that kind of disease?
Motor available?
Animal models.
Animal model. Yeah, there is animal model. We did an experimental study before this clinical trial. We did Retinitis pigmentosa animal model. Retinitis
So
pigmentosa.
you use the stem cell, use the animal model?
Not my team, but the biologist team with other team did. Yeah. I just ophthalmic surgeon. We did this in clinical trial after they complete their experimental study.
I think I'm not sure. Did you use intravenous mesenchymal cells? Also?
No.
You didn't.
No.
So you didn't inject anything?
Intraocular only.
Intraocular.
Yeah.
Yeah. And do you think there is any advantage of using intravenous mesenchymal stem cells?
There is a clinical trial in Tel Aviv University. I saw it. They compared between intravenous and intravitreal homing efficiency between both. They found that intravitreal injection is better than in homing than intravenous.
Okay. So, but
we have already blood retinal barrier.
Okay. So, but there is some effect of introducing mesenchymal stem cells intravenously.
I don't have experience in intravenous injection.
Yeah, I see. Okay. Thank you. Thank you.
Thank you.